Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we welcome Dr. Arvind Singhal, who is a professor at the University of Texas and specializes in positive deviance and teaches the only semester-long course in it. And additionally, he is an author of the upcoming book, which will be released on June 11th, and it is called Positive Deviance, a radically different way of solving the world's problems. Thanks so much for being here, Arvind.
Pleasure, Stephanie and Apoorva.
Thank you.
So Arvind, tell us, what is positive deviance? What does that mean?
As you've heard, it's an oxymoronic term. Those who are trained in a sociological sense would say deviance. Why do you want to get close to deviance in any way? And positive deviance, in some ways, it's a little different than our sociological understanding of deviance. It's really a statistical deviation. And when you have a positive outlier for a given problem, so if you're trying to solve a problem, there are all those people who haven't solved the problem. They are the problem. But perhaps there are some who have solved the problem. So they deviate positively from the norm, especially if they've solved the problem without any extra resources, or they've solved the problem against very high odds. So they are deviants because they're not the norm. They are positive because they've solved the problem.
This is something that you said you've seen demonstrated in India in two villages that I guess would definitely be outliers from the current situation, which is pretty horrible. And you said that one has a fully vaccinated village, 100% vaccination, and the other one has had no COVID cases, despite the fact that other places have a 50% positive rate. So what is it about situations like that where you can look at those two villages and say, whoa, what are they doing? How is this working? How are they using positive deviance?
Yeah, and whether they even know that they're using positive deviance. I mean, clearly these two villages exist. One of the pieces that alerted me about this village that is 100% vaccinated was sourced through National Geographic, a source that I trust. So, and this is the one which has 100% of the community members vaccinated. So clearly they're doing something different. And in the case of the village where, poor community, mostly agricultural, had a lot of resistance to vaccines. So, facing the highest of high odds. But over a period of time, in the last few months, given vaccines became available only in the last few months, they have found a way to not just make these vaccines accessible, but also acceptable. And they've done so by small little things, bringing in influencers from the outside who would sit with influencers from the inside, let's say the village chief or the village priest, the village teacher, and they being the ones who get the first jab. And while these first jabs are happening, there are little smartphones that capture that, and that turns into small little trigger videos that go out on WhatsApp. And then when a second round happens, a few more people are invited, and you sort of get the idea. So it's credibility, trustworthiness, going at things slowly, not telling people you should do this, but actually showing those who are getting it done. The involvement of the priest, brings in a certain aura that this is sacred. You're doing this because this deity protects you, and you have those kinds of blessings. So there are a whole host of not just biomedical undercurrents here. They're socio-cultural, religious, sacred, familiarity, trust, all coming together gradually. And you proceed along those lines, and given people are so connected, right? Individuals who belong to families, families who belong to neighborhoods, and the priest, of course, is the village priest, the chief is the village chief, all these overlapping, cascading networks, and it tips. And it tips enough that it's 100% now.
That's so fascinating, Arvind. What I find when you've tried to teach me about positive deviance over the years, very grateful for that and for your joining the show. One thing that's always stuck out to me is that these people are somehow solving this incredibly complex problem without any additional resources. And that's what you've said in your couple of comments here as well. I mean, this is a village just like any other village in India, so they're not getting access to a grant. They don't have a wealthy philanthropist. They're not suddenly more educated, than the other villages. And that's always the striking thing. All of the behaviors, the micro behaviors, as you've called them for me, they all can be undertaken by any village. And yet it's somehow one village that manages to put these micro behaviors together. And I find that really, really impressive that somehow without having to appeal to any external aid or new technology or new intervention, that this is all within the grasp of all of us. So I don't know. I'm just restating what you've said, but I'm hoping that you can underscore that as well and help our viewers understand how important that is.
Yeah, I'm a big fan of W. Edwards Deming, and this is the guy who transformed Japan and brought performance improvement and quality improvement to the US. And I don't know much about his work, but I do know about, he often talked about the 4 pillars that make up what he calls profound knowledge. And the first pillar, and he's basically saying, if you want to improve something, if you want to fix something, you can go the route of, let's identify defects. And, that's quality control. And in essence, what he's saying is, it is highly important to recognize that whatever you do, there's always variation, right? When you have variation when you're building rivets or making rivets, defects and quality control. But in human systems, he says, when there is variation, or at least that's my interpretation, he says, and if you can pay attention to something that is varying a little more, and of course, you always vary in terms of range and in terms of, the range of deviations, then it's important to pay attention to those. And if you begin to pay attention to the positive variations from, quote unquote, the mean or the central tendency in a statistical sense, it can be very insightful. In fact, Deming says it can be profoundly insightful. And so here, when I talk about this community, it clearly is performing well, tremendously well, in the context of the problem that you're trying to solve, right? Now add to that it is also performing well with no extra resources. And this is like variation squared. And that's profound. If I understand Deming, that's profound. Because it exists, right? I mean, you can't deny that it's not a pie in the sky. It's in the ground. And so I think what we are saying here philosophically, statistically, is there is profundity when you see variations of that kind. And if you begin to pay attention to those, as opposed to our habit of focusing on the defects, because we are fixers, right? We are engineers. We are repair people, right? This is not working, so let's fix this. Of course, that is indeed the intention of the positive deviance approach too. You want to fix the problem, but you fix the problem by looking at variation squared, because it exists, and figuring out how did they get there, because the key is there. And so it's intriguing, right? I mean, it's even to a person who is very logically minded, it makes sense. But we don't think that way because we are not trained to think that way.
And you said before that humans are a variation in themselves, because when you were relating it to medical care, you said that the heart doesn't lie to the lungs and the liver doesn't lie to the stomach. They all, when they're giving you whatever symptom or feedback, that's accurate, real-time feedback, and it's not something made up. Whereas people have the ability to be in a meeting, or you used the example when we were talking, being in an operating room and the surgeon being completely ready, gloved up, scrubbed in, totally ready to go, and then a beeper going off and touching it, and having somebody having the nerve to say, you just touched that beeper. What is it about those people that, is there any common thread in those people who are the difference maker, who are the deviants in the positive ways, that people can replicate, or that we can look to or recognize if we see somebody and think, oh, that's the person we need to be following?
It's an excellent question, and I can answer that at multiple levels, because positive deviance also is a very versatile approach. You can look at statistical deviance at multiple levels. You can look at it at the level of individuals. Are there certain anesthesiologists who are doing a better job than others in terms of how they, either they wheel their pediatric patients in, or some who carry, very few who carry them in, or, surgeons who engage in certain, I mean, you can look at those things at the individual level, but you can also look at units. How is this surgical intensive care unit doing relative to something else, to the orthopedic unit? Maybe, they have higher levels of infections because, they're, cutting more, and so on and so forth. So it's a highly versatile approach. You can look at, you can also do upstream and downstream intervening, right, with the positive deviance approach. So when I teach this class, basically I'm teaching them a different way to think, right? If you're interested in solving the problem among Hispanics in El Paso, Texas, right on the US-Mexico border, because one of the biggest problems is diabetic management. You can ask the question, are there men and women over the age of 40 who have a diagnosis of type 2, who are poor, don't have medical insurance, but yet who have been able to control their diabetes because they have a certain, level of A1C, 6.5, with no, or just the bare minimum 500 milligrams of metformin? And if the answer is yes, then whoa, we found, and and I'm just narrating these studies because we have done these studies. So you can look at positive deviance at the level of diabetic management. There's no reason why you can't go upstream and ask the question, are there families where you would expect children to be obese? Yeah, with the same socio-demographic characteristics. And are there some positive deviance among those? You get the idea? You can also go downstream, right? In terms of those who have rehabilitated themselves, let's say, in a better way after they've had an amputation, right? So you can go, prevention, management, rehabilitation, mitigation. And that's the beauty of the positive deviance approach, because you're basically saying there's variation in practice, variation in populations practice at the continuum of upstream, downstream, prevention, management, rehab, treatment, whatever else. And so now you can really develop a very comprehensive approach to the problem that you're trying to solve. And ordinarily we are very piecemeal. Yeah, we are, and nothing wrong with it. I mean, that's the way we've been trained to think.
I think you've also brought out to me in the past that the whole inquiry starts with data, because in order to know whether you're deviant, positive or negative, you have to have a sense of what is the data, what is the mean, and so what is the deviation. And so one thing that's striking me as you're saying, you were providing your last comment, is it possible that ultimately all we're trying to figure out is what are the variables that could potentially be implicated in this data, and the positive deviant is just one for whom we haven't identified what that variable is, and or is there something that's still an untapped skill or potential in that person that we haven't somehow figured out how to capture?
You use data. You can use data. There are other ways to ask who is at the highest risk, right? Against all odds, over the age of 40, Hispanic, no medical insurance. You get the idea? Diagnosis of type 2, they have the highest odds, and they shouldn't be managing their diabetes well. And then, of course, you flip. You ask the somersault question. And for that, data is very helpful, right? If you have access to it. Are there some students who shouldn't be performing well because they're first generation, English is not their first language, poor socioeconomic status? I mean, all the high risk factors. Oh my God, but, they're graduating with a 3.8 GPA and, blah, blah. Oh, okay, right? So data is very useful where it exists. Now, the question you're asking is there a variable which explains, and that is hyper-local and hyper-contextual. So it would be hard for me to say, however, having said that, given we deal with complex social problems, given I'm a professor of communication, usually the little thing that tends to make the biggest difference, and obviously it's a little thing which doesn't cost anything, no extra resources, is a behavioral act, a micro behavior, or 2 or 3. The anesthesiologist in question, what is it that she does that others don't do? Well, she comes and she asks for permission. Mr. and Mrs. Singhal, do I have permission to pick up your baby? Oh, right. Yeah, well, yes, please, as opposed to I'm going to pin the baby down. And, so there's care, there's holding, nonverbal, but very relational. Yeah. And now she's administering verbal anesthesia. That's a communicative act, right? Peekaboo. Interaction, with a child, right? While simultaneously, the assistant locates. And now, better clinical outcomes because you're not jabbing it 5 times before it, And then she asks for permission to carry your baby to the surgical room, to the operation theater. Now that's a communicative act. And then as she walks 4 steps, she turns, she looks at you, she makes eye contact, she pats your child on the back and says, and you may not hear her words, but this says, he's going to be okay. And what does it do to you when the anesthesiologist who's going to put your baby to sleep is telling you he'd be okay with me? So it's a series of little, to answer your question and to answer Stephanie's. You can tell because it's very hyper-local, hyper-contextual, but given it doesn't cost anything, It has to be a behavioral act or two, a series of behavioral acts. Often these behavioral acts are communicative in nature, and they create a different kind of a healing space.
But Arvind, I think you just kind of nailed it for me. Again, every time I speak with you, I feel that I'm actually unpacking the layers of positive deviance, and you sort of just brought it out. It's the micro behavior that you're looking for is often about the relationship and about the communication, both of which come freely to all of us. They're available freely to every single one of us, yet only a few of us are accessing them. So if I'm getting that correct, then I guess the question still comes back to, is there a particular skill then that these positive deviants have somehow learned that they've taken up, and that's what's helping them solve these problems? And is that the skill that we're trying to distill unto others?
Apurva, you're coming at this question in a way that somebody who teaches positive deviance is going to say, Apurva, hold on, because it is the discovery of what is happening that is uncommon and different, which is, very context sensitive for a given problem. So I don't know whether I'd go that far, but I would say maybe if I do a meta study systematically of all the, but I can certainly say that if you begin to pay deep attention, if you work in a space which has a complex environment in terms of hierarchies, if you begin to pay attention to the quality of the relationship, not one time, quality of the relationship as it plays itself out through these micro actions and repetitions of these micro actions, you will see that takes you to a different place. And because these actions are so micro, we usually say, oh, that was nice. Oh, I love this doctor, right? The guy, he asks me first to sit down, and he sits down. He doesn't ask me what's wrong with you. No. He begins the conversation in a different manner. He begins by asking me, hey, did you get those pictures developed from your last trip to the Grand Canyon? Why? Because, he charts this personal stuff along with your blood pressure, and he knows from your last visit that your son was playing on the varsity basketball team and was trying to, get to the university team. And if he asks, so usually those who go that, I don't even want to call it extra mile, because you'd say that everybody should do this, right? Who go that mile, given it violates the norm of expectancy. This violation of the norm of expectancy in a positive manner is what delivers better outcomes.
What is the number one message you want people to take away when they get your book?
Humility. Fundamental principle of positive deviance is, I don't know, but somebody here knows. Somebody here has solved the problem. You can get it through data. It's very liberating because you don't have to be the expert. Of course, you have your expertise. Your expertise is to relinquish your expertise temporarily. And because the answers are there, because there's always variation, profound knowledge.
Well, thank you very much. I love this conversation. I learned a lot, and it was just fascinating. So thank you so much for being here. We appreciate it.
Pleasure, Stephanie.
Thank you so
Pleasure.
much.
Thank you all for watching. Bye-bye.
Thank you.